Diseases of the stomach in dogs and cats, and vomitus and regurgitation. The diseases are acute gastritis, gastric erosive ulcerative disease, which are ulcers, chronic gastritis, delayed gastric emptying and gastric motility disorders, and GDV, which is gastric dilation volvulus syndrome, and gastric neoplasia. For acute gastritis, talk about the etiology, spoiled food, foreign bodies, chemicals. For the clinical signs and diagnosis, it's good history but has vomiting. And the treatment is no food and give antiemetics. For GEU, gastric erosive ulcerative disease, which is stomach ulcers, discuss the gastric mucosal barrier, talk about the causes such as NSAIDs, metabolic diseases, and toxic agents, and talk about the diagnosis. So if you see anemia and melania, do endoscopy. And the treatments such as H2 blockers and giving epinephrine, which causes vasoconstriction and stops bleeding. Next, talk about chronic gastritis. Talk about the causes, Helicobacter, parasites, diet, the classifications such as lymphocytic, plasmacytic, eosinophilic, granulomatose, and the diagnosis such as the C13 urea breath test, and treating with immunosuppressive therapy and low-fat and low-fiber diets. For delayed gastric emptying, talk about obstruction such as pyloric stenosis, and giving cisapride for motility disorders that are idiopathic. For GDV, gastric dilation volvulus, discuss the clinical forms such as with dilation or without dilation, the diagnosis such as a CRT over 2 and distension and tympany, the consequences such as damaged capillary and shock, and the therapy such as gastrocentesis. And then talk about gastric neoplasia, and then also talk about the 3 surgeries, gastrotomy, gastropexy, and gastrectomy. So the clinical manifestation of gastric diseases. Vomiting is the most common sign. There can also be hematemesis, melania, anorexia, abdominal pain, abdominal distension, diarrhea, and weight loss. The first disease is acute gastritis. The etiology is anything causing inflammation of the stomach. This can be spoiled and contaminated food, foreign bodies, toxic plants, and chemicals. The clinical features are, it's more common in dogs and cats. It's seen when there's an acute onset of vomiting and a loss of appetite. The diagnosis is done by exclusion when there's a good history, and it often improves within 24 to 36 hours. The treatment is to withhold food for 24 hours. And if there's persistent vomiting, you can give an antiemetic, such as maropitant. The second disease is gastric erosive ulcerative disease. This disease involves stomach ulcers. So the overview is there's a gastric mucosal barrier, and bicarbonate neutralizes hydrochloric acid, which protects this barrier. The gastric mucosal barrier has prostaglandin E, which is produced by the gastrointestinal mucosa. It increases mucus and bicarbonate, it regulates blood flow, and it increases epithelial cell growth, and it decreases acid secretion. NSAIDs can cause direct damage to this process. It inhibits prostaglandin synthesis. Such NSAIDs are aspirin, phenylbutazone, ketoprofen, and ibuprofen. Corticosteroids can also cause ulcerogenic effect if they're given at a high dose for a long time. Metabolic disease can also cause ulcers, such as liver failure. You have decreased gastric mucus production and decreased epithelial cell renewal. And in renal failure, uremic toxins can cause ulcers. Also, stress-related factors can alter gastric blood flow, such as hypotension, shock, and sepsis. And increased gastric acid secretion can also be caused by chronic gastric distension. In gastric ulcerative disease, we can often see anemia and melena. And for the diagnosis, the endoscopy is the gold standard. And for the treatment, eliminate the predisposing factors, such as if it's caused by the liver or the kidney. Fix the diet by giving a low-fat, single-protein diet. And you can also give antacids, such as H2 blockers, such as famotidine, and PPIs, such as omeprazole. These decrease acid production. The next disease is chronic gastritis. The clinical occurrence is 35% of chronic vomiting is from chronic gastritis. The symptoms are intermittent vomiting, abdominal pain, and melania and weight loss, even up to anorexia. The diagnoses are endoscopy, X-ray, ultrasound for foreign bodies, and thickened gastric wall. The specific causes of chronic gastritis are Helicobacter, which is a gram-negative bacteria, parasites, dietary antigens, and foreign material such as sand. There are 3 histological classifications for chronic gastritis. The first is lymphocytic plasmacytic, This can be Helicobacter, especially in felines. The second is eosinophilic. This is an allergy to food antigens. Or it can be an immune response to parasites. And the next is granulomatous, which is for chronic infections against parasites or even foreign bodies or neoplasia. And to diagnose Helicobacter, you do the C13 urea breath test. And then to treat, you give amoxicillin and metronidazole. And to treat chronic gastritis, excluding the specific causes, you give a low-fat, low-fiber diet. Then you do an antiparasitic therapeutic trial and then a Helicobacter elimination trial. And if all above does not work, do immunosuppressive therapy, such as prednisolone. The next disease is delayed gastric emptying. It's a huge group of diseases. You can have gastric outlet obstruction, such as pyloric stenosis or a gastric ulcer or neoplasia, or even a foreign body. Or you can have gastric motility disorders, such as gastroenteritis, pancreatitis, and abdominal pain, stress, or trauma, or post-GDV, or even constipation. For the diagnosis, we can see vomiting and large amounts of undigested or partially digested food. And we can normally hear abdominal tympany. In the lab tests, we can see hypochloremic metabolic alkalosis. This is because chlorine is not getting into the blood. On the radiography, we can see fluid distended in the stomach. Give barium sulfate because it's retained in the stomach after 4 hours. In pyloric stenosis, it can be congenital or acquired, especially in older male brachycephalic dogs. We can see projectile vomiting 6 to 8 hours after feeding, and you can diagnose with an endoscopy, and the treatment is pyloroplasty. When there are gastric motility disorders, you can give a prokinetic such as cisapride or metoclopramide to help move the gut. The fifth disease is GDV, gastric dilation volvulus syndrome. There are 3 forms: dilation without torsion, so a lot of food is eaten quickly, and this stretches out the smooth muscle fibers and causes atonia. And then there's dilation with torsion. This is found in large, deep-chested breeds. It's in a peracute or acute disease. There's a dislocation of the pyloric region around 90 to 100 or 180 degrees, so a complete rotation. And the third type is volvulus without evidence of dilation. This is very rare. Initially, it's a local disorder leading to dilation or torsion of the stomach from left to right. There is a decreased stomach wall perfusion and stomach wall necrosis. The risk factors are 1 meal a day, rapid gobbling of food, and aggressive temperament. We can see an increased capillary refill time, over 2 seconds, and a reddish and pale or cyanotic mucous membranes, and there's also a weak pulse. When doing a detailed examination, we can see a barrel-like distension of the epigastrium. There is a drum-like tympany and a palpable splenomegaly. And we'll hear no gastric or intestinal motility, so no borborygmy. The general consequences of GDV are compression of the thoracic organs and cardiac shock, and ARDS, acute respiratory distress syndrome, especially pulmonary edema. It's caused by damaged capillary networks. For the therapy, do vein catheterization and fluid therapy. Then you give an antiarrhythmia treatment such as lidocaine to fight the tachycardia. And then you perform a gastrocentesis to compress the stomach as soon as possible. Puncture the uppermost region of the stomach, and once you hear borborygmy, remove the needle with confidence. Don't worry about leakage. For anesthesia, do orogastric intubation and sedate with benzodiazepines. To induce, you do ketamine or propofol. Then you do the gastropexy surgery. The fifth disease is gastric neoplasia. It has a low incidence in pets. In dogs, you can see adenocarcinoma, and in cats, you can see lymphoma. And the symptoms are weight loss, worsening of vomiting, anorexia, melena. For the diagnosis, look at the symptoms, then do an ultrasound, endoscopy. You can see thickened mucosa, and then you can also do a biopsy. For surgery, there are 3 surgeries: gastrotomy, gastropexy, and gastrectomy. Gastrotomy is done in the case of a foreign body. Note that foreign bodies is not a surgical case in 95% of cases. Manipulation is often successful. But you do an incision on the serous layer strictly halfway between the lesser and greater curvature, and you remove the foreign body entirely, and you close with doing a double layer closure, penetrating the mucosal layer and then the seromucosal layer. The first layer should be cushion suture and the second layer should be Lembert, interrupted and continuous. For a gastrectomy, you can have a partial resection or a Billroth 1 gastroduodenostomy or a Billroth 2 gastroduodenostomy. And for gastropexy, this is the most important phase of GDV surgery. It's fixing the stomach surgically to prevent further reoccurrence. So for the incision, you cut the seromucosal incision from the parietal surface of the antrum pylori. Most of the stomach isn't free, therefore do an anteversion or a retroflexion of the stomach if possible. Before closing the stomach, make scarification of the ventral stomach body and involve the stomach in the closing suture. This acts as a fixating fold. Do this halfway between the pylorus and the cardia. It equalizes stomach tension. After operation, the animals should be kept in for 3 to 5 days. They should be stabilized, and their acid-base electrolyte balance should be maintained. And they should be given metoclopramide as an antiemetic, and they should be given prokinetics as well. And H2 antagonists such as cimemetine.